Hey, and welcome to the lecture. Before we jump into the learning, just a quick reminder to check out the workbooks available on modernoptician.com through the Ultimate Apprentice Optician Study Guide or available on Amazon worldwide. It's the best way to accompany this lecture so that you can fill in the blanks, label the diagrams, do everything all concurrently, and elevate your training to the next level. All the links to the workbooks and the website are all in the description down below, so make sure to check it out. Other than that, enjoy today's lesson.
Right, medications that affect vision. I almost took this one out. It's another one that I almost didn't do this lecture because it's a little long and it's not necessarily going to be stuff that we deal with every day. However, I decided to keep it in because I just want to touch on a few things. We're going to breeze through this. And I want you to just take this with a grain of salt. Essentially, I want you to understand that there's other factors outside. If anything, I want you to just take that message home, is that it's not always about what's happening directly in front of you. Sometimes people's vision can be affected and compromised because of the medication they take, and it's not always your fault, right? So, but I wanted you to avoid going down these rabbit holes of trying to check everything. Um, I mean, of course, it's good to check everything and make sure that your work was accurate. However, sometimes you're at a disadvantage right from the beginning. So this is going to be more to serve for you to understand. There's a whole bunch of stuff here that can affect vision, a whole bunch of medication that can affect vision that you have no control over. Even some of these, like I'm not even completely familiar with it. I'll stop for a second every time I've had experience with some of these. And some of this stuff is literally just kind of like, 1 in 1,000 or 1 in 10,000. But anyways, I just wanted you to see that it's not always your fault, right? All right, let's jump into it. So first, Fosamax. I've seen this before, that it's commonly used in, to prevent bone deterioration. Well, it turns out that people could be prone to orbital inflammation and uveitis and scleritis because of it. Not necessarily going to affect you, but good to know. Cyclosporin and tacrolimus are drugs that are used to have undergone, organ and bone transplant. Well, this can lead to vision loss as well. Again, not something you necessarily have to worry about, but we're just building a case here for saying that there are drugs here that will affect vision, so you never really know unless you're either asking questions or checking the chart. Minocycline, I've seen this, very, very commonly used in acne treatment for younger people, teenagers primarily. It can actually lead to intraocular pressure and papilledema. So this is something that is monitored by the physicians that are treating these kids. Not necessarily something you're going to be dealing with. I certainly hope not. However, minocycline can have a negative effect on vision. Plaquenil, you're going to see lots of this. Plaquenil is very commonly used in the treatment. You see here malaria, lupus, but very, very commonly used in rheumatoid arthritis. And it's been known to create retinal toxicity. So patients who take Plaquenil, or more common, or also just as commonly referred to as this generic hydroxychloroquine, will be referred to be tested routinely, primarily through OCT scans, so that they can make sure the retina is in good shape. So you're going to see lots of that. The reality is that most people can take Plaquenil and still be healthy because the doses have been adjusted over the years to try to prevent this retinal toxicity. But it is still important to realize that there can be negative effects on vision due to Plaquenil. This is more chronic, by the way, than it is acute. Uh, Ethambutol is a drug that's used to treat microbacterial disease, including tuberculosis, sorry, and it can affect the optic nerve. All right, so anybody who's taken that in the past could be visually compromised without you knowing. Topiramate is used to treat epilepsy and migraine headaches and can cause angle closure glaucoma, and so people have to be more careful. Not necessarily vision altering in this case, but can affect the health of the eye. Topamax. Topamax is actually very commonly used to improve urinary dysfunction problems, right, in men and in women, and it can actually cause complications during cataract surgery. Again, not something that we have to worry about per se. However, it does affect the eye. Amiodarone, I've actually seen this in action. Amiodarone is used to treat cardiac arrhythmias. It's a heart medication, and it can actually cause weird little whorls on the cornea. Usually benign, usually doesn't affect vision. However, if it is significant enough, it can, and can also cause ischemic optic neuropathy, which is really bad news. So it's something that, most physicians are aware that the person is on amiodarone and they're being careful for it, and it can affect vision. So again, this person could be on medication and for their heart, and you have no idea that their vision is compromised when they finally get to you. Anticholinergics are used for people with stomach conditions and Parkinson's disease, and it can hinder the accommodative reflex. Think of that, right? This person is taking something for something completely different, and you're trying to troubleshoot why they're having a hard time reading, and turns out this entire time that they have an accommodative reflex issue. Right? So again, behind the eight ball, again, trying to solve these issues. So once again, any little bit of knowledge you have about this stuff is important. Now, you would hope that the physician or the optometrist would catch something like this and communicate it to you so that you don't have to go fact finding. However, again, in a perfect world, that would be the case, but it's not always the case, right? Sildenafil and tadalafil, which is Viagra and Cialis, can create optic neuropathy. Therefore, it is something that has to be careful, that you have to be careful of. Again, optic neuropathy is going to be more of a chronic condition, but if they have had optic neuropathy, that can have visual implications that, once again, you may not know of when coming to see you. Diuretics, these are medications that are commonly used to treat blood pressure. All right, it can actually increase the progression of glaucoma and therefore increase, peripheral vision loss if left untreated. Accutane, very, very common, and it's used to treat acne. And it can actually have a negative impact on the tear flow situation, where an increased ocular inflammation, and it can really create an intolerance to contact lens wear. And as we know, if the tears are poor, vision can be poor as well. So I've actually seen this in action when I worked in refractive surgery. Accutane was actually a disqualifier for a lot of people from getting refractive surgery for that reason, because the tears were not healthy enough to be able to support surgery and healing and a proper refractive result in the end. So Accutane, important one to realize. Because again, if you're going to be fitting contact lenses, you don't want to be putting people in a precarious situation when you should know in advance that they're taking a medication that kind of disqualifies them. Tamoxifen, this one's a medication that's used commonly in breast cancer treatment. It can cause corneal opacities and cause problems with visual acuity. Unfortunately, this is something that, when it comes to saving a person's life and treating them for cancer, sometimes it's a means to an end, and any kind of problems that result from it are considered acceptable losses because of the general, goal here. So, corticosteroids, very, very common. I've seen this in action as well. Commonly used to fight inflammation, both systemic and all over the body, basically. Very commonly used in respiratory treatments, right, for like asthma and infections and whatnot. Corticosteroids, prolonged use, can cause premature cataract formation, right? So, and especially in younger patients who don't necessarily get their eyes examined as frequently, they might have cataracts that you don't know about because of corticosteroid use. So, you could be at a disadvantage if they always see well. It turns out they had a cataract the whole time. So, right. And I'm just moving through the next ones. Caffeine, well, that's a common one, can actually contribute to accommodation issues, pupil size, and corneal thinning. This one's a little bit of a stretch. However, just so you know, right, there's always something going on in the background. This one's wrong. Alcohol, I don't think you should be injecting alcohol. So I think I got the wrong one here, but this is commonly injected drug linked to increased risk of AMD and cataract formation, increased ocular mobility. That was actually supposed to be heroin. But anyways, let's see if we're back on track here. The inflammatory effects of this can affect the eye's vasculature and ocular surface. I want to see if I've got cannabis effect. Yep, we're still good. So it's funny how I had to read it to make sure. However, so tobacco can have an effect on things like, delayed healing. Tobacco meaning smoking, right? Risk of cataracts, of age-related macular degeneration, and glaucoma. Cannabis, marijuana, though it does reduce IOP, can be associated with conjunctival issues, with chemosis, with severe corneal opacifications. So it's kind of give and take, right? I know that there's this like common like urban thing where people think, oh, cannabis is used for glaucoma therapy. I mean, it has been in the past. I don't think it's considered one of the best ways, just because it reduces the amount of excuse me, of aqueous humor is being produced. It's also used in pain management and things like that too. So the benefits and negative sides of cannabis have been well documented, and we don't have to go through it too deeply here. Cocaine, well, big thing with cocaine is pupillary response. Also can affect lid retraction. It could have effects on the conjunctiva, and it could decrease corneal sensation. So again, these are all things that person's lifestyle could have an effect on their vision, and you don't even know it, right? So I don't necessarily suggest that you ask them to let you know of all the recreational drugs they're using. However, it is something that could be in the back of your mind, that not even in the back of the mind for a specific patient, just knowing that there are things that people do in their lives that could have an effect on vision that you have really no control over, right? And methamphetamines, again, recreational drugs, can have major effects on the sclera, and the retina and different parts of the eye. So just so you know, these are all recreational drugs here. They are all bad news for the eye, and you wouldn't even know it because you're not likely to ask these people if they're taking methamphetamines, right? So just kind of a tidbit just for your knowledge. So optical significance, opticianry significance. Well, of course, this is not mandatory knowledge, and I just breezed through this. So I think the take-home message is just that knowing this type of information can help you better understand your patient's visual needs, right? And understanding that sometimes you can't control their vision and you can't solve their issue. And it's not the end of the world if you can't, because sometimes things just can't be solved and managed at your level, and that's okay, right? But at the end of the day, knowing this stuff is the difference between a conventional optician and a modern optician, right? Because we always focus in modern optician on being better at what we do and taking knowledge from adjacent fields and different things and understanding what's going on around us to be better at our job. So of course, like I mentioned, this lecture isn't necessarily going to be something I want you to dwell on too long because it's not as beneficial as other lectures. However, this is something that can give you a little bit of insight as to what can be going on when other conditions are being treated and the medications have an effect on the eyes. All right, I hope you enjoyed that one. All right, let's move on to the next.